This video is about implant failure. If there are any terms or concepts that are unfamiliar, please refer to my website, centerforbreastreconstruction.com, or one of the other videos in this series for some more basic explanations. There are two main categories of breast reconstruction for breast cancer patients who undergo mastectomy: implant reconstruction and autologous reconstruction. Autologous reconstruction involves using the patient's own body tissue to make a new, natural, living breast, while implant reconstruction means using a device that is placed under the skin to resemble a new breast. While any operation can cause problems or result in complications, different operations often carry risks of unique types of complications. When implant reconstruction doesn't work out, the implants need to be removed. This is called implant failure, and this can happen for a variety of reasons. Implant failure is common and occurs in a high percentage of patients. In fact, in around 40% of patients who have had breast reconstruction with implants, the implants ultimately are removed and never replaced. No operation is perfect, and it is important to understand the risks of an operation before making a decision. Since implants are foreign to the human body, they are never recognized as self. As a result, the body naturally forms a layer of scar tissue around the implant. This is called a capsule. This layer of scar tissue is normally thin and innocuous, but the capsule can become thick and problematic. When this happens, the layer of scar tissue can start to tighten up around the implant. This is called capsular contracture. In mild cases, the capsule may cause a slight hardening of the implant. If it continues and worsens, this hardening may become uncomfortable and even painful. In severe cases, it can become visible and restrict mobility, causing chronic pain. Other reasons that implants can cause problems and ultimately fail are infection, open wounds, seromas, and an entity called breast implant illness, or BII. Breast implant illness is poorly understood and therefore not often written about or discussed. The term describes a set of symptoms that may be vague or intermittent. These symptoms may be related to other chronic conditions like autoimmune phenomena, which may be exacerbated by the implants. Many of the symptoms may mimic other conditions and therefore are confusing and hard to diagnose. Many of the symptoms are also similar to other issues associated with breast cancer treatment, like chemotherapy. BII symptoms may also resemble changes that occur with menopause. For all of these reasons, when women present with breast implant illness, it has been very hard to prove scientifically that their symptoms are directly and exclusively related to the implants. When symptoms are severe or begin to impair a patient's lifestyle or sense of well-being, it is indicated to remove the breast implants and replace them with the patient's own body tissue. There is no consensus on a defined group of symptoms that would specifically confer a diagnosis of breast implant illness, but a basic list usually includes fatigue, joint and muscle pain, cognitive difficulties or brain fog, anxiety, depression, and headache. If the patient is suffering from chronic pain or decreased mobility, this can certainly influence and exacerbate any of these symptoms as well. When symptoms of breast implant illness persist, it is logical to remove the implants and replace them with autologous tissue. When problematic breast implants are removed and replaced with the patient's own body tissue, symptoms usually resolve. To learn more about implant breast reconstruction and its alternative, natural tissue breast reconstruction, or autologous breast reconstruction, please check out some of the other videos that cover these topics more specifically. You will also find these terms defined and explained on my website, centerforbreastreconstruction.com.